Good evening, everybody, and welcome to aidbees. On today's podcast with us for National Safe Motherhood Day, we have Seema Kazi Rangnekar with us from Sama Birthing Center from Bombay. I would like to welcome her first. Welcome, Seema. It's really nice to have you with us and talk about the cause and talk about the concerns and safety and motherhood in general. We'd like to welcome you from all of us.
Thank you. Thank you so much. So I'm Seema Kazi Rangnekar, founder of Sama Birthing and Beyond. I am a childbirth educator and a parenting coach. I work with and lactation. So I work with parents or expecting parents, also young people or people who want to become pregnant. So from the preconception phase to pregnancy to postnatal and beyond. And my job as a parenting coach and a childbirth lactation educator is to support mothers, fathers, families in this journey to make it safe, to make it positive, not just physically but mentally, and the support that a mother needs at this point of time in her life is my like my goal and my aim to make her feel supported.
Great, great.
Part of the services that we offer at Sama Birthing, the main point being to help a new mother or right from the preconception phase to guide her, to support her. It could be physically, it could be mentally, it could be the lack of support she feels in terms of her partner or family. So the whole idea of Samabhating and beyond is to support new parents, expecting parents, or even later on, where we have different professionals where we collaborate with and who are on board Samabhating. So, like a nutritionist, a psychologist, a doctor, a gynac, where they kind of keep supporting parents, and together with my own expertise, which is on prenatal fitness, postnatal fitness, nutrition, lactation, and so on.
Great. Uh, really great, really great concerns. And, so let's start by talking about the idea of this day that we are talking of, National Safe Motherhood Day, and what your 2 cents or what your thought on the idea of safe motherhood would be.
Yeah, I think really speaking honestly, although the need for this is more not just for it is usually seen that in rural areas is where there's a lot of medical neglect, and that's where women suffer a lot. I would also I feel, and I've seen it in my 10 years of practice, where women generally, when they are in this whole phase of birthing, it's a very doctor driven, a medical care driven situation, where only if the care doctor, in our case we talk about a doctor, abroad it would be midwives and other practitioners, is going to support the mother, will she be able to get the birth of her choice, unmedicated birth or a vaginal birth, for example. So, unfortunately, this still seems a very far off dream where the woman is allowed to birth the way she wants to. It is very controlled and guided. So, on one hand, you have the women in the rural areas where they have absolutely no say, and they are just told wherever they go, maybe it's a local uh, midwifery practice or a birthing center or a hospital, they just have to go along with whatever they are told. And very often there's neglect, there is sepsis, and there's a lot of women who die, children die. And on the other hand, in the affluent or the urban areas, there is a C-section or cesarean or belly birth, as we call it, is very, very rampant because of this whole way of looking at things, unfortunately, and fear.
Right.
Yeah.
In terms of peers, the social context and the rural and urban background that we're talking about in terms of being a mother, in terms of dealing with motherhood, where do you think the whole context of it comes from in terms of how do you view motherhood as a part of a system where uh, rural urban discrimination is one thing, then there are several factors to relating it to a mother. So how do you view that idea of difference of how a person is reared into becoming a mother? So do you think that impacts the idea of motherhood?
So if the woman feels supported, if she feels like she's being heard,
Right.
um, and especially if she does not have any medical issues, and if she gets to give birth the way she wants to, for example, because that's how mostly the mother, that's where the whole problems start from. And
Right.
if you ask any woman, she'll always look back at her birth. And most women, I have read researches where they have been impacted lifelong about the kind of birth they had, and they wish it was different.
Right.
So that's why the whole idea of this motherhood safety day would should be where um, it is understood that she needs the support, she needs um, the understanding, not just from her partner, family members, but also the medical services that are out there, and not to be treated just like one more patient, which she is not. She's a
Absolutely.
client and not a patient. She's
Right.
not sick. She
Right.
needs to be there just for giving birth safely.
So, yeah, talking about this idea of mental health and how a mother's mental health is important, where do you place the responsibility of the family that is there with the mother, maybe her father's or paternal or maternal family, or the partner who's there with the mother? Where do you place the onus of responsibility on them while she's dealing with the new experience of motherhood?
So there is one thing where the woman goes through a lot of hormonal shifts when she is in her postpartum. So it is said that she hits bottom, which is a fact. And of course, different women respond differently to the postnatal period, but largely most of them, I have even conducted kind of a survey amongst my group of moms, and 98% of them said they felt lonely,
Okay.
and they felt where they felt even if they had help. Okay, these are women who are from very affluent, I'm talking about. I'm not even so I'm just saying that even if they had the help in every sense of the word, like multiple people caring for her and baby, she felt lonely, and she felt very, very sad. So this is the state of a new mother,
Mhm.
and the role of the partner, the family, is so crucial around this time, not just in terms of the physical support, but the mental support.
Right.
So the sensitivity to understand what she's going through, and to and it's not like she needs to be given or done a lot of things. It's just to be heard, to be comforted. That's all that is
The
required.
family people, like her own people, essentially.
Yes,
Yeah.
yes. And if need be, to talk to some specialist. Uh, and I wish the same thing goes even for rural areas, or even
Yeah.
the underprivileged, where there should be someone to address these concerns for them.
So a question pops up in my mind when you talk about the idea of therapy and the idea of someone being there for the mother, right? So how do you think, or where do you place the idea of ASHA workers here who are there for rural women, providing their, because an ASHA worker essentially provides almost all kinds of care in terms of the, like the suggestions and advices and medicines and everything. Where do you place the responsibility of an ASHA worker as related to a mother in a rural area?
I feel they have a very important role because there is sometimes the fact that there is, maybe like they have other such huge thoughts bothering them there. Where will the food come from? Where's the money coming from? So,
Hmm.
there's so much other things, like they may not have enough to clothe the baby, or, things like that. And they need to also, there's no education to and maybe they also brought up differently, where they are not expecting anything from their partner
Okay.
because it's a woman's thing.
Right.
Largely the culturally, this is how women in were brought up, like this is a woman's thing, it's nothing for the man. Like even birthing was a woman's thing, the man wasn't ever involved. It is now that the women who are in the urban areas, or even still there are some parts of urban areas, or some women where only the doctor and the mother is giving birth, the partner is not there in the birthing room or in the
I see.
labor. So, there's such a big gap, there's such a lack of awareness. So the only person who can really help out here would be then this Asha worker, right?
Right.
They are the ones who will be somewhat helping these women.
Correct. So
Their role is so important.
the role becomes more important in.
Yes, absolutely, to keep their sanity and guide them.
So on sanity, Seema, one another question that comes to mind is all, I think, in terms of popular culture and popular consumption also, this has also come up a lot. The idea of mother's guilt and what exactly mother's guilt is and where it comes from, maybe what's the context to it. Can you talk to the audience a little bit about that?
So yeah, I think that's something that doesn't end. It's really strong when the mother gives birth, and she's also very possessive. She does not want to share the baby. Many mothers have told me this, that I feel very insecure. My baby is not looking towards me. It's quite amusing for us, but actually, they find it hard that the child is not looking at them, but looking at everyone else around them and smiling. Why is my child not looking at me? Or I've gone to work and I've come back feeling really guilty that I've left my baby for the first time, and my baby didn't come to me. My baby's going to everyone else. Is there something that I did? Why is my baby? I mean, these are little babies, 6 months, 7 month babies. So it is there and there. How mothers feel very guilty. They feel guilty all the time, and it doesn't stop. It goes on for a very long time, even when they have older children. So it's something that we need to work about on. So it's something where the mother needs to talk about it openly. It
Right.
should be discussed in openly, so that everyone feels like, okay, it's normal, and I need to function in such a way that I don't take the onus on me all the time, or don't feel bad for having done something or not done something, because you're a human after all.
Correct. So, any particular advice that you'd like to give, specifically new mothers, how to deal with this mother's guilt?
Yes, my advice is don't be hard on yourself. You are a human, you can only do this much. You need the help, you cannot possibly do everything. Um, and everything cannot be always done your way. The others who are helping you or pitching in may not be able to do it your way. It's fine, it really, really is fine. And you need to take care of yourself. If you don't take care of yourself, you cannot take care of anyone else. And a child needs a happy mother, doesn't need a sad or a unhappy mother. And it's not going to be useful at all at any level, like whether it's a newborn, it's a
Correct.
1 year, 2 year, 10 year, 30 year. The and the happiness or the contentment comes from us within. So that's something that a mother has to understand, not to take it too um, not to take it on herself that it's her fault, or she's not being a good enough mother. it's not going to help at all. So they need to just
That's
work as much as they can, what is within their capacity, and then just it's okay.
absolutely important. Absolutely important. So in that spectrum of talking about what a mother's deal, like what a young mother or specifically a new mother could deal with, or generally any mother for that matter deals with, is something that also comes up in head is the idea of the prevalent gender discrimination within the society. Where you have a particular sort of convention or the idea attached in your mind that okay, what if the baby that this mother has in her belly, what if it's a boy or it's a girl? So where does the idea of gender discrimination or the decision or the idea of the thought of okay, what happens then, where does that stand for you?
You're trying to ask me about boy or girl?
Yeah, the idea of, so the impression of gender discrimination or the whole prevalence of gender discrimination as a concept for a new mother, where do you see that? Is there something that comes as an impact on this mother, or how does that impact the idea of safe motherhood in her?
Yeah, I wish to believe, I hope it's no more there, but it's there. Unfortunately, where there is still that, a boy child is required, even if. Uh, so yeah, I've noticed that it's still there. Although I feel little bit maybe, but a large percentage still would want to have a boy over a girl, or if they have had a girl then definitely want a boy. So yeah, it is stressful, right? It is stressful for a mother. She may be worried all the time whether she is having a boy or a girl. So especially in the rural setups, and even in our urban setups, I don't think it has changed much, sadly. There is still this pressure of having that one child who should be a boy child.
Correct, correct.
So it does affect the mother.
Is pretty much prevalent. So we're kind of moving on to the end of this discussion, Seema, and it's been really, really insightful for me as someone. I mean, I come from a context where I can't relate to absolutely everything that a mother might go through, but there are still things that we talk about. There are still things that are being discussed about in the society as concerns, specifically for new mothers, because you see this age, this post-pandemic age that we've reached to. How do you see that building up a new kind of definition, probably for a mother, or how do you see the pandemic impacting the whole idea of motherhood in a longer perspective?
So you know that unfortunately COVID affected pregnant women very adversely.
Exactly.
They were many of my clients who I worked with. They were very stressed. Some of them had premature births. Some of them lost their babies.
Right.
Um, they were feeling extremely unsupported because there was absolutely no help from the other members of the family.
Right.
If, in spite of being pregnant, many of them had to do all the work alone, and that took a toll on their physical and mental health. Mental health, for sure, a large proportion of women went through a very difficult phase, and I'm sure it has impacted the baby, and time is going to show. We will see the repercussions. It was really really hard. I tried my best to support these women during at least the women who were in touch with me, by giving them hope and keep guiding them. So yeah, COVID has and is going to mentally affect not just women but also their babies, because there is something called as womb psychology and Garbh Sanskar, as it's called in our culture. So it is going to impact the human race in a long term, and we will see the repercussions.
Correct. So just the last question, last bit about it. When we talk about the whole impacting and the impact on mother and child, how do you see this specific concept of postpartum depression acting there? Like, where do you place the idea of postpartum depression and how to deal with it for a mother who goes through pregnancy and who goes through the entire process?
So, most women go through something called as postpartum blues, which is very normal. They feel very low, very sad, and they cry at the drop of a hat. It's very normal because of the whole hormonal shifts. So, almost 9 women out of 10 would say that I did feel that for a couple of days. But there are also a large number of women who continue to feel these feelings of sadness, hopelessness, no interest in anything, or no interest in the baby, just carrying on life just for the sake of it. So there's a large portion of women who are going through this. Very often not getting any kind of help, or asking for help, or seeing a counselor or a psychiatrist, because it could be taboo
Right.
still. Or things like, you have your baby now, why are you sad? Or figure it out how to deal with this kind of, so it is for real. And I know for a fact that there are parents, moms, who are struggling with it, and we really need to talk more openly. We really need to create more awareness that there is normal to feel what you're feeling, and there is hope, there is a way to come out of it and go back to leading a healthy life again. So but it is there very much, and I think there is, it's just the lack of awareness that is and the whole this of looking at it as taboo, that it's not something to be discussed openly
Right.
or talked about.
So when we talk about the idea of postpartum being a taboo, and so it would be something essentially which people need more education for, or which people need, which people need more awareness about. So how do you think there are any resources or any ways that people can talk more about it, people can know more about postpartum depression? Would you like to suggest something to the audience in that regard?
Yeah, so like people like me, I work with women. I keep talking about it. I keep sharing information from my side. I even work together with psychiatrists and psychologists. So at any point of time, I hear from my clients saying that she's not feeling good or she's feeling helpless. I immediately recommend that they do a counseling session and not just leave it, because very often uh, in their head it's like it'll get better, it'll pass, but sometimes it just gets worse. And I have I mean, unfortunately not so many women talk about it openly, but I was approached by one husband, a partner, who came to me and called me and says, it's been 4 years, but I can see my wife is not the same. And that's when then he took an appointment for her, and they went to a counselor, psychologist, to help her with her concerns. And they found out that she's suffering from a postpartum depression, even
Mhm.
4 years later.
Right.
And so the only way forward is to people like me, to talk openly about it, to put out more stories of other women, to give hope through stories of other women, and not feel okay. This is not something that you need to live with. It's something that you need to take help from and get over it.
Absolutely. So, Seema, on that note, my last question, we would not want this discussion to end because this is going really insightful and really helpful, but time constraints. And so my last bit and last question to you would be on that. Have you particularly noticed, because you were like, we're talking about stories here, we're talking about mothers here, we're talking about parents here in general. Have you been able to notice a particular sort of change through these years where you've been seeing so many stories, so many people, so many patients or clients coming to you for that matter? Have you seen any sort of change or sort of transformation towards a better world for mothers throughout this particular experience? How has your experience been like that?
Well, sadly, my world of mothers is a very small world
Okay.
from the larger picture. So my world is not a depiction of the larger picture, unfortunately. But at least what feels good is that women are becoming a little more open. They are not so uh, they're not so quiet or so closed as compared to earlier, like say 10 years back when I started. They were very reserved or not so openly discussing concerns and issues, even if it was all women together. Of late, I see that change where they are okay, they are talking, they are asking questions, which is good, which is needed. They are talking about it with their partners, which also never happened earlier. So
Right.
I think in my little group of community of women, the voices have come forth and they are openly supporting and talking. But I don't think the larger picture, there's still a long way to go. There's still
Long, long,
a
long.
lot of work to be done. And I'm glad organization like yours is taking the initiative. We need many such organizations to hold hands and do this work of supporting the mother, because if there is a mother who is supported, there is a child who is supported, there is a adult who comes from emotionally secure home. And it's all connected, and I think
That's
our,
absolutely, that's absolutely.
yeah, so it's not just the mother, it's like a whole community then.
Yeah, right. So one mother, the
Yeah.
entire community. That's how you join the units. Yeah,
Yes, absolutely.
yeah.
I mean, yeah, a lot of work to be done, but still, there's always hope.
Right, right, right. It's been a pleasure talking to you, Seema. I really wish this conversation was longer and we could talk about it, but again, time constraints. And I really hope that we've been able to give the audience with something that they could learn from, they could get educated from, they could reach out to us, reach out to you for this particular
Yeah,
business. And
yeah. I am on social media. I'm on Facebook as Sama Bhoting. So if there's anything, any questions, any suggestions, I'm happy. I'm really look
absolutely,
forward to it.
the audience would like to get in touch with you through us as well, and we'd love to talk more about it. We'd love to discuss, educate, make people aware, and make the world a kinder world. So thank you very much, Seema, for being with us. Thank you very
Thank,
much for being with the audience.
thank you so much. Thank you for having me. It was my pleasure.